So one of the best things that you could do for yourself is to adopt a healthy lifestyle. That's in addition to the medical treatment that your neurologist and your healthcare team would prescribe for you. But um, changes in your lifestyle should be done sort of small. We know that that's the most effective way to make permanent change is to do small things a little bit at a time. Things that are most beneficial in terms of changing lifestyle would be things like eating well. And so that would be not necessarily any kind of fad diet or anything really particularly unusual, but just about good general nutrition. That usually helps to improve fatigue levels and help people have more energy. Things like Canada's Food Guide is probably a really great place to start. The other things that might be helpful would be to have regular exercise, and that doesn't necessarily mean signing up at the gym, but it means about getting some daily exercise to improve your mobility and your muscle tone. Smoking cessation is a very important thing. We're seeing more and more evidence around the importance of not smoking. There's a lot of studies out there that show that just in terms of other general health for your heart and lungs, but in as well as progression in MS. So we know that not smoking is very good for people that have MS. Other things that are also important can be things like making sure that you're only drinking alcohol in moderation, that you're getting adequate rest and sleep, and you have good stress management in your life so that you're not carrying a lot of extra stress. And there's other things as well as like making sure, just public health things as well, making sure your immunizations are up to date, that you're getting an annual flu shot, and doing things that are simple infection prevention like good hand washing. So all of those things it can be kind of overwhelming to do all of those things at one time. So it's important to maybe pick one thing to work at a time. And generally, if people are needing help with coming up with a plan, they can talk with their healthcare team, their family doctor or general practitioner, or their primary care physician are often very helpful in helping people to get to the resources that they need. If it's a dietitian for nutrition, or an exercise specialist such as a physiotherapist if you need to design an exercise plan. So again, one of the most important things that you can do for yourself is to really start to take good care of your body, and that generally helps people to feel much better, even though they may have a chronic illness such as multiple sclerosis.